You know, as we see the increased number of positive cases, the increased number of folks being hospitalized, we're getting to a point where it is beginning to really hit home for a lot of folks. I know 4 individuals who are friends of mine have tested positive. Several of them have had very serious health implications. And the last day I spoke to several of them over the phone who asked that we convey to the public the seriousness of this illness, even on those who are young and generally healthy. It can have very serious health implications, and that is why we are asking for the public's help and cooperation in the physical distancing efforts that we have laid out, in the stay-at-home orders that have been given, the mass gathering restrictions that have been put in place. We want you to be healthy. We want you to go outside and go for a walk or a run, but not in large settings. And family units can participate in things together. And I come from a large family unit, but some of the pictures we're seeing of folks at parks and at beaches and areas are clearly not one intact family unit. And so the severity of this does lead us to remind the public to please adhere to this, because even if you feel young and healthy, it could still have a very serious health implication. But also you are endangering other folks. If you contract it and you are contagious, you are putting at risk those vulnerable populations. And so we are asking for the public, particularly in these public settings, to please adhere to the guidance and advice that have been given out. They're all in an attempt to flatten the curve. If we can slow the rate of transmission, if we can slow the rate of spread, then those folks who need critical services, hospital services in particular, will hopefully have the ability. We can maintain the integrity of that system, but it really is incumbent upon each and every one of us to do our part to ensure that that system remains viable and available for those who would need help. Another part of our efforts is to try and increase the capacity of our healthcare system. This morning, a number of us were on a call with the leaders of all of the healthcare systems in San Diego County, working through a variety of issues, including how we can come together to try and increase the capacity. And I'm incredibly grateful for the leadership of all of our healthcare systems in San Diego County, for their collaboration, for their cooperation, and the creative steps that they are taking to make sure that we can begin to increase that capacity. And in particular, we are grateful for the state of California. Late yesterday, we were notified that San Diego has been selected for a mobile field hospital. This is essentially a configuration of supplies and equipment that, provided we can identify the proper location and siting of it, could provide up to 250 new hospital bed capacity in our region. We are going to work with our healthcare providers. We're going to get details on what's coming. It could be stood up in a standalone location, or it might be more appropriate to augment existing healthcare services and systems. But we do appreciate the state of California's continued effort and the federal government's continued effort to help us, not only as we flatten the curve, but as we rise the level of available healthcare capacity in our region. But these increased capacities only work if we have the healthcare workforce to help us meet the need. And although we have activated our Reserve Health Corps, we are asking for any individual who may be out there who is a healthcare provider, who is not currently employed or busy, or who has extra time that would be interested in volunteering, maybe a doctor or a nurse who recently retired, we are asking you to go to healthcarevolunteers.ca.gov, healthcarevolunteers.ca.gov, and fill out a form with your information, with your specialty, with your availability, because anyone out there who is a healthcare provider, we want to make sure, if you have available time and you're willing to contribute, that we can put you to work to help achieve the aims of increasing our capacity. And so we appreciate anyone's participation there. It's also not just the physical health needs that we are trying to address. Here at the County of San Diego, we are very aware that issues of financial distress, issues of anxiety and isolation could be triggering mental health challenges in our population that's out there. And so we are going to continue to ramp up and provide more services and help and support for individuals who are out there. If you are in an emergency situation, our emergency networks still exist and are functioning. You can call 911. If it doesn't rise to that level, but you feel that you need help, our Access and Crisis Line is a powerful resource to help you if you are having a mental health crisis. That number is 888-724-7240. 888-724-7240. Help is available to you 24/7 in over 150 different languages. And then there are some small steps that we can all take to help maintain our pathway as we go through this, maintaining routines related to meals and exercise and bedtimes, connecting safely with others, maybe via technology or video chats. And while it is good to stay informed, perhaps avoiding too much exposure to news sources, inflammatory sources of information, or a point we've made repeatedly, the random speculation and rumors that tend to get spread at any point during a crisis. We would really encourage you to trust reliable sources of information. Our county's website, coronavirus-sd.com, is a valuable resource. And then really encouraging within your family open conversation, within your family unit about folks' anxieties and concerns and fears, to talk about them, to talk through them, and then reach out to us. More information on mental health and coping with COVID-19 can be found on the county's Behavioral Health Services website, and we stand ready to provide all of the assistances that you may need. And then in closing, I just want to share that although maybe at the national level things might spill into a state of bickering from time to time, here locally we are all moving forward together. Today we saw our hospital systems working collaboratively. We had a number of us gather, some in person and some virtually, with elected leaders from city, from state, from all political parties of providers who are all coming together to find every way that we can possibly move forward together. We've reached out to a number of businesses, both on the philanthropy side and in access to resources and buildings, and every time we've asked for help, the answer has been yes. And so I think San Diegans should take comfort that through this uncertainty, our community and our institutions are coming together and working together, not just out of a spirit of connection or community connection, but out of a spirit of what I've heard described as community solidarity. Solidarity being a very powerful word where everyone comes together in their unique way to meet the challenges we face. So thank you to everyone out there for all that you're doing, and we will continue to move full speed ahead. Next, I'd like to introduce Dr. Wilma Wooten, our Chief Public Health Officer.